very warm good morning, uh, Dr. Tripathi, Dr. Sandeep, Dr. Gajendra, Dr. Brahmprakash, and all members of AEOST. It's indeed a pleasure for us to be here, and I think it was a couple of months ago that this idea was suggested that a symposium be held as regards occupational health and vision. So we were really excited about this opportunity because I think among the senses, the vision or the eyes are one of the most important things that a person has. It's only if you are just put your hands on your eyes for 5 minutes and see what a blind person is all about. So it is something very important that one needs to do because often eyes are very prone to get injuries in occupational health, and that is also the lifestyle changes that are happening vis-a-vis all of us wanting to be now on computers and your smartphones, etc., which is causing a lot of strain. And if you look at the incidence of even myopia, the incidence of myopia is galloping. There are countries in the East Asia, Japan, Taiwan, Hong Kong, etc., where at least 60% of the people are having myopia, and so are our children today. Apart from that, I think all of us are also exposed to noxious environmental pollutants, and that is giving rise to a significant increase in the number of patients who are coming to us with ocular allergies as the incidence of bronchial asthma, skin allergies is increasing. So I think it was worthwhile for all of us to bring you up to date to ophthalmology. And ophthalmology today, I would say, is one of the most rapidly growing technology. And as was mentioned by Dr. Tripathi, I think because of the fact that you can visualize each and every part of the eye, there are so many minute equipment, instruments, and especially lasers that have been developed. If I start thinking of the number of lasers with different wavelengths that are being put to use in ophthalmology, they could easily cross about 16 to 20 of such lasers. Each particular part of the eye is targeted. You can focus lasers onto that, and you can get excellent results from there. Well, let's see. The secretary, Dr. Sandeep, gave a great outline of what AEOHD is doing. And the association, I would say, whenever what is very important is that they do a lot of work in CMEs, constant medical education, because the education needs to be updated because there is so much of technological advancement that's happening in every field that it's very difficult to keep up to pace. Though we have access to the digital world, but I think where you can have interaction with experts, that's something very, very important. And I think the theme of this, that is vision and work, envisioning the worldwide advancement of ophthalmology, is a very apt theme that we have for this conference. As was told by the secretary, and Dr. Tripathi was also telling me that AEOSD is associated with the Indian Association of Occupational Health. And this was started, as told to me, in the steel city of Jamshedpur way back in 1948. So that means our forefathers did have the vision at that particular time that as industrialization is going to progress, there is going to be specific need with a specific focus on the health of the workers and the employees in any industry. And this was started by Lieutenant J.R. Kocher, Colonel Najib Khan, and Major Tarapur. And thereon it has increased, and it has today a strength of 3,000 members that is there. As has been said, the Association of Environmental and Occupational Health Delhi has won several awards for having increased the membership, and this state branch is doing a lot of good work. And we can see our Navrats, all the PSUs that have really made India proud, are all the doctors there have all been associated with this Association of Environmental and Occupational Health, and it is indeed great. And in any way we can support your activities, we are actually, I would say, we are fortunate enough to do that. Now, as was said by Dr. Tripathi, there is no growth or there is no development without industrialization. And industrialization is necessary for a better quality of life. Things which were earlier not considered to be normal are today considered to be normal. All of you today would wish to be in a comfortable environment, to have, an air conditioner, or you should have pure drinking water. So there are a lot of things which have come on, which have become absolutely which we take for granted that these things should be happening. But whenever you have progress, there is a byproduct of industrialization could be hazards. You have seen accidents happening like the Union Carbide accident or the leakage of Chernobyl plant, etc. So things have to be taken care of, and whenever there is a potential threat because of these hazards to health, safety, and environment, I think that is where the role of IAOH and AEOHD comes. And therefore, you as the frontliners at that particular time when they were there, wherever there is a hazard or a problem that happens, you have to be the front leaders and to take on the situation and bring it under control. Now, when you're looking at ophthalmology, Dr. Prakash just talked about it. None of us has really taken adequate care about caring for the eyes. Now, these are deleterious radiations. You can get radiation cataract, etc. that happens as he's talked about, and these are preventable. So what we will through this day symposium want to tell you that there are eye hazards which are present, and you have to have safety goggles, glasses, etc. to prevent any adverse event. You don't even know that a person may be getting exposed to noxious pollutants which could cause chronic dry eye irritation to the patient. The patient is not able to, or the employee is not able to concentrate on work. The other important thing is that ocular injuries, because if you don't protect your eyes, these are the more exposed parts, and anything which enters the cornea can damage the lens, go on to the retina, and cause a lot of problems that is there. The other important thing which was talked about was the quality and quantum of vision. Unfortunately, even when a child is born, is never tested for vision. That is something very important. You have problems of ROP, etc. coming. When a child is getting admission into school, there is never even an eye exam that is done, and that is it is only detected later in life that a child has a squint or has an amblyopia or a lazy eye, and then we really can't do anything because the plasticity of the eye has gone off. So what is very, very important, I would say, is that you need to emphasize that, and wherever we can as Center for Sight help, that there should be an annual examination. There are diseases like glaucoma, cataract, diabetic retinopathy. A lot of people don't get their eyes checked even though they have diabetes. And diabetic retinopathy today is one of the leading cause of blindness in the most developed countries. So you have to ensure that if a person has to do a job well, the first primary thing is he has to see well, because you cannot actually do a job which you are not able to see. As to what, like he was talking about drivers and buses going down the gorge, etc., and that is all because a person may be having glaucoma or has a retinal detachment or something. He or she is not able to see from the side. So these are important things that have to be done, and I think in this very entire CMEs that you are having, we are now doing the vision and work, and this is the outline of the program which you all have. And I wish you all the very success for this conference. Quick 2, 3, 4 minutes on what Center for Sight today is. Most of you are associated in some way or the other or with Center for Sight or your organizations where we provide eye care. And the CFS story actually starts from my having left a secure job at the All India Institute of Medical Sciences, having joined AIIMS in 1976 as an MBBS student, and been there for 20 years, and as an associate professor at that particular time, a secure job, though my parents were dead against me leaving a job, being possibly one of the youngest people to become a faculty there, because there was an itch to create something in the private sector, which was an institution, a super specialization within ophthalmology, and which was giving excellent quality, cutting edge technology care to the patients. And that is what it is, to create something which was numero uno or number one. And it was this itch that led us to start Center for Sight from in 1996 from a small single room practice, and therefore collected a lot of ophthalmologists. We have many ex-faculty from All India Institute of Medical Sciences. Then we had ex-chiefs, Dr. Dada, Dr. Tiwari, Dr. Prem Prakash. They were all who have been associated with the Center for Sight. And what is very important is that clinical excellence and foresight to build an institute has been something very, very important. And in our ideology, it is institution above self. That is what is important, that despite anybody having whatever stake in center of sight, it's the name of center of sight which is important and which needs to be working on the four pillars of precision, efficiency, uh, and integrity and compassion. So these are the four pillars that we have. And from 1996 today, in 2018-19, we have close to 50 centers, and we are spread across 9 states and about 30 cities. These are the locations where Center for Sight today is. And we recently got associated with Anand Mahindra's Mahindra and Mahindra, which is a large industrial house, and they have invested as a minority stakeholder in Center for Sight, and we wish to expand within India as overseas. Now, what is very important is that Center for Sight has always been centric on doctors. And doctors, we have tried to collect the best in the field and best in the super specialization. So we have a doctor-centric model where doctors decide their own destiny. And today we have the next gen of ophthalmologists. As you will see, I think I am the oldest to address you. Maybe one more. We have a lot of ex servicemen who are with us, two major journals. We have Dr. Tarun here. So there are about 10 ex service doctors who are with us. And we help the doctors create an ambience of research to give excellent clinical care. And this is our team. As you can see there, we have about 150 ophthalmologists with us. One important thing that Center for Sight believes is that we need to have technological leadership. And we have often always got the best of technology, and we have been the first movers of technology. Now, what is very important is, I don't know how many of you you would recognize. You can recognize that this is a foot. Just now you had the Chandrayaan going, but unfortunately at the last mile we couldn't land. But all of you can recognize that this is the footprint of a person on the moon. But how many of you can recognize this guy there? He's not Neil Armstrong. That's the problem. So yeah, he's right. So he's Bush Aldrin. So Bush Aldrin, only maybe one person answered. He was the second guy to step on the moon, not the first guy. He was just after Neil Armstrong, but nobody of you recognizes. All of us remember Neil Armstrong. So that's what is important, is that at times we may be spending a little more to get a technology, but if a technology is working, I think Center for Sight is keen to acquire that technology and get the technological leadership. So there are several milestones. I won't go into the details of it, but in the history we have had several first to ourselves in Center for Sight as regards saying the femtocataract, the smile procedure, the blade-free LASIK, etc. And that is what it is. And obviously it is important that we are doing the work with a lot of passion. And what is important is that the patients need to go back satisfied. Now, what we also feel, and this is also part of that, is that we need to give back to society. And the first part of the society where we need to give back is to have our juniors be better than us. And that is what is where we do that. We want to teach, we need to instruct, and we need to mentor and inspire everybody and guide them and influence them to be better ophthalmologists and better human beings. And to be able to, today we are in an environment where doctors are the punching bag for almost anybody in society. Started from the Prime Minister, and today everybody wants to punch doctors, saying they never see the adversities under which we are working. But never mind, these are passing phases. We still need to work and do and get the next generation doing better than us. So we have legacy of teaching, and we run the National Postgraduate Education Program, which is the eye focus, where we get 300 ophthalmologists from India and overseas, and we give them a 1-week refresher course to see as to how they can give the exam and how they can fare better in life. We do optometric training. We have interns from Oman who come, Hyderabad University, Amity, Jamia, and we do internship training for them. Now, after 22 years of hard work, passion, inspiration, whatever you may say, and the love of the patients, Center for Sight has been able to fulfill its dream of establishing. We invite all of you to see this Center for Sight Eye Institute at Dwarka. Which is there's a 1700 bed Delhi government hospital coming right opposite us, which should start in the next 1 year. And this is a 90,000 square feet facility dedicated to ophthalmology. And we have everything here. We have research. We are doing cutting edge. We are happy to say that J&J international company that you know, we are the only clinical site in the world doing study for the next generation of femtolasers. And there are at least 5 other studies which are going, and we have started long-term fellowships, short-term observerships. Anyone wants to come and see the type of work and type of things that is happening in ophthalmology, we are always happy to host you. And the R&D, as I told you, we have an in-house ethics committee, that is the research approval board, which is there, and all our studies go through that, is DGCI approved. And we have several trainings that are going on. Now, what next? I think Center for Sight today wishes to expand and to obviously create an institution and a legacy which we are there, and to spearhead ophthalmic research and trials. We have also started DNB, and the number of seats of DNB, we have 4, and we are going to keep on increasing. We are also wanting to start optometry. And in case there is anything over time, we can even start short-term courses for refresher, 5 days, 7 days, for the ophthalmic health doctors also to come and see as to what are the common ailments of ophthalmology. And we'll be happy to do anything which gives back to the medical fraternity and to the community through the medical fraternity. I would just say that the world is changing by the minutes, and so is ophthalmology. Never, I think, has technology been so advanced and so rapid. I would say the next 5 years or the next 10 years, ophthalmology or technology in medical care would be what it took, say, 100 years to come to that level, because the quantum is exponentially increasing. And I would say today we are talking about bionic eyes for reversing blindness. Patients who had optic nerve disease or retinal disease, etc., who were earlier said that there is nothing that can be done. The bionic eyes are being developed, where you can connect to the brain to give signals so that a person can see something. We are presently working with this British company on the Oxide smart glasses for visually impaired, where you have the peripheral vision gone and you can work, say, in patients of retinitis pigmentosa. You are today, the idea came, if you have a phone and I need to take a picture and I just put this, there is an autofocus. So similarly, there are companies which are developing automatic glasses. That means that your glasses, instead of wearing presbyopic glasses, you have single, but in case you want to look there, from the impulse from your brain, the focus of that, they can change. Similarly, smart contact lenses, which could zoom on demand or something, which are being developed. So there is a lot of work. Google is investing a lot in contact lenses which can give you 24-hour glucose monitoring of your body without it being invasive. That means that you don't have to take a blood sample, but it's just a contact lens, and the tears obviously have glucose, so you can kind of look at measuring how the patient is, the glycemic control of the patient. You are having the CRISPR, which is the gene therapies which are looking for retinitis pigmentosa, Leber's, etc., and these are things which are developing, and I foresee that there is going to be, like in all parts of medical sciences, in ophthalmology also there is going to be great revolution that is there. Teleophthalmology is something which has come big. The use of smartphones to take pictures, the concept, again, I would say this is again a study which Google is investing a lot, where they want to have kiosks in malls, etc., where anybody who's walking can get a picture of the retina done if you have diabetes or any other disease, and this can go by teleophthalmology. So there is a lot of scope, because what happens is that you can actually visualize all parts of the eye. That's what I said. And this also is a smartphone. Is now we are also working with an American company where the smartphone is going to be used to check the power of your eyes. So you can actually have a small device and you just need to focus on the chart and it will do an autofocus and your number will come out. So it is, so that could be that you don't actually need to go to an optometrist to get your power. So there is so much that is happening to get these things, and I think refractive errors are something which is there in at least 50 to 60% of the people, and that needs to be treated. And mere spectacles can take a person from a poor living or a child performing ill, not well in a school, to maybe becoming a topper because he or she can't see the board, what is being projected. So those are things that are happening. And I would again wish to emphasize that teleophthalmology will definitely help reduce the burden of blindness, controllable blindness because of diabetic retinopathy that is there. One more thing which I talked about briefly is then in occupation you are having lots and lots of problems which are also related to the smartphones, to the computers, etc. But what all of us, especially you people, have to do is to get a safe workplace, and safe workplace is what is going to make a sound business sense. So therefore, investing in your workforce to make them better performers at the place, because they should not have any eye defects. I think that is very important. And with that, I wish to congratulate you for organizing this symposium, and we wish to thank that you have involved Center for Sight. And these are the doctors whom you will be listening over the course of the day, giving you various insights into eye diseases as things stand. So, welcome once again, and thank you very much for having me here so that we can all work together to bring safety onto the work environment, to give protection to the employees and prevent them from workplace hazards, and do the best for all the workers in the industry. Thank you very much for your kind attention. Thank you.